Good morning, Mrs. Bethune. My name is Tori, and I'm part of the Respiratory Care Department, and I'm here today to draw your arterial blood gas sample. So that's going to be a little bit different than any type of blood draw you've had during your stay here. Probably the draws that you've had earlier were venous draws, and this draw is important for us to do because this is going to tell us how much oxygen you have in your blood as well as how much carbon dioxide you're retaining. And so the results from this draw are going to tell me what's going on exactly so that I'm going to be able to better help you breathe. Okay. So we'll go ahead and do the draw. I'm going to have you hold both of your wrists like this for me, and I'm going to feel which side has the strongest pulse. Okay, this one has the strongest pulse, so I'll have you go ahead and lay your arm just like that on there, and then I'm going to do what we call the Allen's test, and so I'm going to occlude both your radial and your ulnar arteries, and I'm going to have you open and close your fist a series of 3 times, and then I'm going to release the pressure on the ulnar artery, and we should see blood flow back into your hand within a few seconds. If we don't, that's going to tell me that you don't have enough blood flow for us to do this. Okay, so I'm going to go ahead and occlude both arteries here. Okay, I'm going to have you make a fist for me. Now open, close, open, close. Okay, I'm going to release, open, and see how the color ran back in? So that's telling us that you have enough blood flow to do this.
Good.
Where it was kind of white and blanchy before, now you're pink again in the palm. So that's telling us that you have enough blood flow. So I'll go ahead and wash my hands. All right. All right, now I'm going to just clean the area with an antiseptic wipe. And I'm also going to clean the fingertips of my gloves so that we're not getting any contamination. All right, so I'm going to go ahead and uncap my needle here. Okay, and I'm going to feel for a pulse. Okay, right there I have a really strong pulse. So with the bevel side of the needle up, I'm going to do a 45-degree angle, holding this like a pencil. You're going to feel a poke. Okay. And we'd already drawn back the plunger for how much blood we needed, so we're going to wait till that fills. A little over 0.5 milliliters. Okay, and once that's full, I'm going to go ahead and hold pressure on there. And I'm going to use my safety shield on my needle so we don't get poked. Okay, and that pressure is going to stay for 3 to 5 minutes or until the bleeding stops, depending on if you have any type of clotting disorders. I'm going to be looking for redness, swelling, excess bleeding, or if you're experiencing any residual pain. Go ahead and put a Band-Aid on your arm there, Nancy. All right, and then I'm going to take your blood sample and seal it, and then I'm going to go ahead and push any air that might be in there out. Label that with your information, and that's going to go into the biohazard bag, and that's going to get sent to the lab. Then I'm going to go ahead and clean up all my area, taking my sharps and putting those in the sharps containers, and I'll go ahead and disinfect the area. Do you have any questions for me about what we did today?
No, thank you.
All right, thank you very much.